The idea of this course is to pick up on specific areas where there have been advances that have clinical implication in the daily practice of neurologists.
We had some outside speakers here regarding acute stroke, endovascular therapy for acute stroke, use of TPA, the treatment of and improving acute stroke performance in our Florida Stroke Registry, and ESIS, embolic stroke of undetermined source.
If there are seizures, it's important to know if these are provoked seizures or they're unprovoked seizures.
It's not neurologic or psychiatric. Everything is neuropsychiatric. So we can take a step back and look at our patients from a combined perspective as neurologists.
We now know that we can treat strokes with intravenous medications to dissolve clots. We can use catheters to extract clots from the brain. And the systems of care that bring patients to hospital for acute treatment are improving on a daily basis.
There is a number of advances coming. Our keynote speaker, Dr. Jovin, spoke about systems of care advances where we could have early detection of stroke with wearable devices.
In many countries, patients are not being treated because these sophisticated advanced imaging studies are not available. Instead of not treating the patient at all, it is better to use whatever means there are available.
My mission not only was taking care of the patient, but trying to connect this network of providers to be able to be at the same pace.
One of the things we talked about today was what's called psychogenic non-epileptic seizures. There's an increased dialogue between neurology and psychiatry and psychology. With that crosstalk, I think that's where we're making some great advances.
We want people to get everything latest in stroke in sort of bite-sized pieces so they can update their stroke each year. Their own treatment of stroke patients can be state-of-the-art 2020 with evidence-based treatments.